Speaker was possible because of the good relationship between President Jammeh and Sall. Until recently, the people in Dongoroba, Jasong and Wellingaraba had to travel to Bureng or sometimes Soma with horse, donkey or in rare occasions by car to receive medical treatment.
The construction of this health facility in Dongoroba, Lower River region will indeed contribute towards our aims and objectives of realizing the Millennium Development Goals, particularly in the relation to the health sector. That is MDGs 4, 5, and 6 in relation to child mortality, maternal health care, and the reversal of HIV, AIDS, and malaria.
The donor for this health facility is not only patriotic but is a philanthropist.
Ako amang kinyemenyin kodo bonni kanyin lockdown lo amang ke bangko dikello da mate bare akita molte me wala me alo ko sor la barem.
We are all aware of government's commitment to the MDG targets.
Ako mutakala mako masakunda e sarta saila londi men alo ko masakunda e wala nganari ngatang janni
and MDG 4 and 5 are particularly held by.
Nani nyawni lulu nyawo wolbe komen dinna wala jati kende ya musol la tanko ani musol ani molbe la jati kende ya ani jio ani dandawla kol wodo wala ko donga sarta flo do so sala.
The principal mandate of the Ministry of Health is to ensure quality, affordable and accessible health service to all.
As if the construction of the health center was not enough or convincing for the youth to return home and fill the void that had been created as a result of their absence, the installation of a water tank that supplies running water to the village and its neighboring villages witnessed a positive showing from the youth of Dongoroba as far as the attendance was concerned. Indeed, for one youth, things seem to be turning towards a positive direction for him. Alpha Dem is undoubtedly one of the youngest chief executive officers in the country. As a native of Dongoroba, he will be remembered as the first CEO the village ever produced. But for Alpha Dem, the job at hand is daunting.
At Dongoro, to be frank enough, we have the standard equipment. We have well equipped, we have a lot of drugs. And then moreover, we are strategically located just at the of the road. It's something like 50 meters away from the road. And if you check from here to that place, how to call it, Japine, a lot of villages are there. And most of these people are coming also from the, as I tell you, our relatives coming from all the way from the Casamas area. So definitely speaking, it is a need. And then sometimes late in night, the person may have emergencies, and then they have to put you on a donkey cart to take you to a nearest health facility.
The construction of this health center by the people of Dongoroba is expected to draw the attention of the youth of the village living outside the village to reconsider returning home and partake in the development of their village and the country by extension.
Well, there are so many issues to be looked at now that the Dongoroba Health Center is operational. For example, how is the momentum that had been there at the start of the program going to be sustained? What plans are there to ensure the investment is sustained?
First step, as you said, for the sustainable aspect of it. We've got finance for 1 year from the sponsor. From now on, whatever proceed we are going to get from this health center, though we have to underline this is not a profit-making project. We have to recover at least the running cost.
Well, it is one thing to establish a health facility. The other thing is to make sure that the conditions are created to ensure its sustainability. Well, the authorities have vowed to do all what it takes to ensure that the hospital remains operational throughout.
You are watching Weekend Spectrum. Time to take a look at what's making headlines around the world.
They say many doctors are at risk of contracting diseases from their patients, and there needs to be stronger commitment to reduce the spread of infectious diseases between patients and healthcare practitioners in Africa. Participants say there is a lack of protective and safety equipment in hospitals across the continent.
The most important thing and one of the most urgent issues in Africa is the lack of resources and materials to treat patients. We need resources in order to access better medical equipment.
There is now better equipment that can help doctors avoid accidental injections from taking place to healthcare practitioners who are caring for patients. There is also unique medical equipment that protects patients from picking up germs from doctors. I think that today, with all medical equipment available, we have to promote the need for better equipment in healthcare sector throughout Africa.
As the sun rises over the Fik Zone district in Ethiopia's Somali region, families are retrieving water from a well before it gets too hot outside. Nearby, a group of health workers are packing up their medical kits as they prepare to go out into the field. They are part of a mobile clinic that travels the region providing residents with health care services because there are no local health centers. The United Nations Children's Agency is working with the government to provide free medical services to people here. Shamis Ali Hared has brought her baby Hassan for a checkup.
In this area, we have a lot of problems because of the drought. My child and I were very sick and very thirsty. That is why we came here today.
The majority of Fik Zone residents are nomadic pastoralists, and it's difficult to treat and monitor their health because they are always moving in search of water and pasture.
Especially when there is drought, when people cannot come to the health facilities, when they are moving from place to other place, then it's the only way that we can help the communities that are suffering from diseases, from malnutrition, from other health-related problems.
At the end of her checkup, Hared receives medicines for treating anemia, while her son is being treated for malnutrition. The mobile clinics are not able to offer advanced health care for the people here, but they are providing a much-needed service for Ethiopia's nomadic community. Ted Chaiban is the UNICEF representative in the country.
Thanks to these 24 mobile health nutrition team in Somali and 4 in Afar, hundreds of thousands of women and children have access to basic health and nutrition services. As Ethiopia comes closer to reaching the health MDGs, it becomes increasingly important to reach out to the harder to reach, harder to access population, and this is an essential strategy.
The mobile clinic program began in 2004 with 2 teams and has since grown to accommodate a large number of residents.
A tiny, single-celled organism in the blood vessels and livers of human beings. It's a serious disease that disables and kills more than 860,000 people every year.